morning. Welcome. It's really wonderful to see you all today. Thank you for having me. I'm Monica Boris. I'm a first-year dermatology resident at the Naval Medical Center, San Diego. And it's a beautiful place to be. I'm sure a lot of you were there for AD. And this is my team here who worked on this case. We're excited to present this at ASLMS because this was the first case in the literature where we used a Alexandrite 755 nanometer laser to treat a very challenging and difficult to treat vascular proliferation that is typically rare. But it was successful in our patient and with no adverse outcomes, so I'm excited to get into it. Also want to note, the expressed views today do not reflect that of the DoD, the Navy, or the US government. So here we have a 42-year-old skin type 4 male with a large pruritic, skin colored to dusky red erythematous plaque on his left cheek that would spontaneously bleed at times and over the past few years was slowly increasing in size and darkening in color. Given the broad differential for this diagnosis, we decided to do a few punch biopsies. And for my path lovers out there, I included this. This is the biopsy that showed a dense histiocytic and eosinophilic dermal infiltrate, and then as you see, there are noted vascular proliferations with large or plump endothelial lining cells, which is known to believe to be most consistent with angiolymphoid hyperplasia with eosinophilia, for short, OLLY, previously known as epithelioid hemangioma. So OLLY is a very rare benign vascular proliferation that is notoriously difficult to treat given its recalcitrant nature to multiple treatments that have been described in the literature with no great gold standard of treatment. Over the past 5 years, our patient did trial multiple different treatments to include topical anti-inflammatories, calcineurin inhibitor, vitamin D analog, topical metronidazole. Unfortunately, didn't do anything. We even put him on doxy for 3 months with no effect, various antihistamines, and a few intralesional Kenalog injections, but unfortunately, no change. He was kind of fearful of going through with surgery to remove this, which has been very well described in the literature because of its high recurrence rate with 40% and poor clinical outcomes. So we put our brains together, and fortunately we train with the very well respected Dr. Vic Ross at our program, who comes over and works in our resident laser clinic a few times a month. And he had a different idea. We were looking up some of the literature, and most of the cases reported that they have used carbon dioxide, Nd:YAG, or pulse dyed lasers in the past to treat OLLY. However, it required multiple treatments and typically reoccurred. So Dr. Ross had the idea of using the 755 Alexandrite laser to target the deeper vessels in the dermis. We used a very high fluency of 40 joules with a short pulse duration of 3 milliseconds, and then the key here is we cranked up the cooling to kind of help prevent any adverse side effects that would come from treating a patient with skin color with Alexandrite laser due to its high absorption for melanin, as we all know. Our clinical endpoint was a transient gray to dusky purple coloration. And then here you can see this was our before on the far left to 1 week after treatment, and then our 2-month follow-up. As you see, the lesion it completely melted off, which was pretty impressive after just 1 treatment and no evidence of thermal injury, dyspigmentation, or scarring. So to our knowledge, this is the first case that demonstrated clinical efficacy and safety of the 755 nanometer Alexandrite laser to treat angiolymphoid hyperplasia with eosinophilia, and to note, in a skin color patient without any adverse outcomes. We believe this rare challenging vascular proliferation responded well to the Alexandrite versus the other lasers, as in PDL, because of its 50 to 75% deeper penetration into the dermis and its greater therapeutic window and relative high absorption coefficient for deoxyhemoglobin as compared to the Nd:YAG. So with increased cooling, we were able to use that high fluence and the short pulse duration and provide a great outcome for our patient without any adverse side effects. Currently, Dr. Ross did present this yesterday. He mentioned that the patient is undergoing scar revision, as you can see there for his punch biopsy scar, and potentially may have a tiny little bit of it coming back. So it sounds as though we're going to be lasering him again very soon. Thank you for listening. I'm glad to be here. Happy to answer any questions.